So we are live now.
Namaskar, good afternoon, and welcome to another edition of our webinars in the series Illness to Wellness. We've been organizing these webinars now since past 2 years. It's already more than 2 years now, and these webinars started uh, in 2020 with the lockdown, with the onset of COVID, when we were so hungry for the right information, the right guidance. SOCHM decided to bring up this preventive healthcare series on virtually, even though we've been doing uh, these programs, awareness initiatives in the societies, we've been doing health awareness camps since many years now. And we've screened thousands of patients for diabetes, for hypertension, for hypothyroidism, for metabolic diseases. We've provided free treatment, diagnosis, and guidance with help of.
You are now the post
Yes.
office. Telephone name.
But with the onset of COVID, we obviously were not able to move out in the community, so we were all restricted to our own homes. Hence, it was decided to go virtually, go online, and bring the same specialists, the same guidance through through these online virtual programs. So during the past 2 years, we've had number of programs on different topics of concern to our audience, varying topics from diabetes, hypertension, and digestive tract, mental health, spirituality, nutrition. So we've covered many different topics, and we are very fortunate to have had with us some very renowned specialists, not only from India, but from all over the world, who've been answering the questions of our audience and providing them the right guidance. And I'm so glad that today we have amongst us some of the most renowned specialists in our country. And the topic of discussion that we have today, that is the brain health across the lifespan. This is a very important topic, and we would be guided in this topic by none other than the most renowned faculties that we have in our country. We would be having Professor Dr. Rajinder K. Thamija. He would be joining us very soon. He is the Director, Institute of Human Behavior and Allied Sciences, New Delhi. He is a very renowned and experienced neurologist. We have with us Dr. Sumit Singh, who's the Chief of Neurology and Co-Chief Stroke, Artemis Hospital, Gurgaon. We have with us Dr. Navdeep Kumar. He's a Senior Consultant in Neurology, Indo-Gulf Hospital, and from Noida. And I myself am Dr. Rajesh Kesri from Total Care Control, Delhi. I'm a diabetologist and a physician. So I'd like to welcome all of you, honorable faculty, on behalf of SOCHM and on behalf of Shri Anil Rajputji, who is the chairperson of the CSR Council of SOCHM. Unfortunately, he could not join us today because of certain prior engagements. Otherwise, he would have been here to start the session and to welcome you all. And I'm very thankful to SOCHM for providing this platform and for organizing this wonderful and very important webinar. Brain, as we all know, is the most complex organ in the human body. And it is the command center. It influences every aspect of life. There's nothing in life which can happen without the brain. It is working even when we are sleeping. It starts working the moment it comes into life. And as long as the brain is working, we are alive and we are there. So to understand what we're going to discuss today, what is the definition of brain health? As WHO has defined it, the brain health is the state of brain functioning across cognitive, sensory, social, emotional, behavioral, and motor domains allowing a person to realize their full potential over their life course, irrespective of the presence or absence of disorders. So, we are going to discuss today how our brain can function better than it is, how we can extract as much as possible from our brains, and how we can live happily and have a healthy brain. So, I start with uh, Dr. Navdeep sir. So, what are the aspects of development during the pregnancy which may affect the later on development of individual of the child into an adult and affect the health of the brain? Let's start from the very beginning. Please unmute yourself, Dr. Navdeep.
Audible now?
Yes, yes.
Thank you so much for asking the question, Dr. Rajesh. As we all know that the organ formation, it develops in the first 3 months, that's the first trimester. So first trimester is the most important among all the three trimesters in the pregnant woman. So the most of the medicines that the patients are having, they cause various kind of neural tube defects or other malformations in the development of the brain, which develop in the first trimester. So pregnancy is a very important part as far as the development of the whole body or the brain is concerned. There was a trial which was done, and it was found that the Swedish kids, Swedish people, they are the most intelligent one. So then the reason was found that the mothers, when they were carrying the children in the Sweden, it's a tradition which is being followed in them for many years that they eat healthy, they exercise well, they listen to good music, and well, they do all the good things which actually affect the development of the brain and the body, which is evident when the child is born and to their adulthood or childhood. So actually, very,
Thank
very
you.
important. The beginning is there only in the first trimester.
Thank you. Thank you. I think that was very important. Dr. Dhamija sir, I would like to request you to give a brief outline of brain health. What are the important topics that are associated with brain health? Even though I try to give a definition, but I think it is quite complex for us to understand. So, what is the meaning of brain health actually?
Good afternoon to everyone, and a very happy new year to all the viewers and the attendees and the panelists. Let's hope
Thank you,
this
sir.
year would be much better than the previous three challenging years of COVID-19. And we hope that the brain health and the physical health both will evolve in a better way, which is need of the hour. So thank you, Dr. Kesri, and thank you, Dr. Anil Rajput and SHM for organizing this webinar on my request. Actually, I was the one who suggested this topic, and it was very quick. And first webinar of the year from SHM is on brain health. That's really delightful, and thank you once again to all of you for having a debate and a discussion on this a very, very relevant topic and an important topic. So brain health is actually an evolving concept, attracting increasing attention not only from the health sector but also from the wider society, stimulating debate and discussions not only in India but across the globe. So on WHO in May 22 actually adopted a resolution in its General Assembly in Geneva this year, 2022 last year, asking the member states, around 200 countries now, to invest in brain health, promotive and restorative brain health, focusing on epilepsy. Actually, that was the first disorder of the brain which was brought to the highlight by the WHO, but it is now epilepsy and other brain disorders. So this has gone through various rigorous scrutiny and the procedures in WHO, including its 150th executive board and the General Assembly and all the other regulatory mechanisms. So it has brought the brain health into focus now, and it is important, and there are various determinants. As you know, the neurological diseases are the second leading cause of disability, the leading cause of disability and second leading cause of death worldwide. affecting 1/3 of the population. So each one of us, one of 3 individuals will have some disease of brain across the lifespan. And that's very important to remember that. So it's a huge problem. And there are various determinants to improve the brain health apart from physical fitness or cognitive reserve, as we call it. The other healthy environment is very important. The safety and security, or whether it is food security or it is air pollution or other things are important. Learning and social connections to stimulate your brain cells, that is very important. And of course, access, affordability, accessibility, and availability of medical health component and services across the populations, whether rich or poor. That is also a very important determinant to improve the brain health. So I think that sums up the importance of brain health. Just to lastly, just to add, to simplify what I say about the brain health, as you drive the car, अगर आपके पास car है, so you need petrol as well as the battery or the electrical component of the car. Similarly, for to run human body, you also need a heart, which is the petrol or the pumping, and as well as the brain, which is electrical in the computer of our body. So both these components are crucial and both work in tandem to run the human body, and that's very important in simple words.
Thank you, sir. Thank you. That was very simple and a very comprehensive discussion. And you've actually given us the direction in which we should proceed and in the way we should go forward about this discussion. So coming over to you, sir, Singh sir, the way usually the general people understand the working of the brain, and to some effect, to some extent, is the memory. The thing which comes first to my mind as well when I think of the health of the brain are two things. I think one is memory and intelligence. So tell us about this function of memory, how to improve, and what may go wrong along the life course. I know it's a very comprehensive topic, but to make it simple for our viewers and audience.
This is a difficult question, Dr. Kesri, but first I should like to thank you and ASSOCHAM for giving me this opportunity of speaking to all these nice people. And Happy New Year to all of you from my side as well. So, memory is something which is remembrance of things. Now, we take memory in very, very different terminologies. Some people feel that if they have forgotten where they have kept the pen, that is a loss of memory. Some people think that if they have forgotten where they have kept the keys, then it is a loss of memory. But actually, memory is much, much more complicated than these small things. So there are 3 or 4 aspects of memory. So it is just like a hard disk of a computer, and actually a computer. So when you type something, the first thing which you type will be available on the screen. And when you are typing, this entire thing which you are typing will go first on the RAM, which is the random access memory. And after that, when you click on save, then it goes to the hard disk. So once we see a thing, we try to read it. For example, the students, we try to visualize it. For example, some people who are trying to remember a visual concept, then they keep on revising it. And once they have revised it ample number of times, the memory gets imbibed into this brain and it becomes a long-term memory. So immediate memory, short-term memory, and long-term memory are the 3 components of memory. So the most important part is the attention. If you're not attentive towards the thing, you will not be able to revise it. Then the second component is obviously revision. So this attention and revision are undoubtedly the most important aspect of managing the memory. So there is a common word which is said that use it or lose it. So the more we work on our brain, the more sharp it is going to be. Many times the kids feel that they are not able to remember things. Now there is a possibility that they might have a inbuilt error of their intellect. So their intelligent quotient, because of some disease or infirmity, might not be good. But it is also important to understand that what is their attention span. For example, I don't like mathematics at all. So I will never be able to remember things in mathematics, but my biology is excellent. My physics is bad, but my English is very fluent and affluent. So it is also depending upon the liking of a child or a person. The people tend to forget things which they don't like. If I don't like somebody, I might forget his name. But if I like somebody, then even if I don't meet him for several years, he might be very easily remembered by me. So, as I told you, attention and repetition in terms of memory for children is very important. But at the same time, if the older people start forgetting things, then it is a cause of concern and it needs to be investigated.
Thank you, sir. I think that was very elaborate and very simple answer, and the way you've explained it very well using the analogy of computer, RAM, and hard disk. I'm sure all of our viewers would have understood. So there's one thing you talked about the use it or lose it, but at times, I've heard people telling their children or that if you do that, if you're doing something repetitively, you get tired. There's a lot of stress on it. So this is one thing which I want our people, what I want our viewers to understand. So if, let's say, we do something, we read a lot or we work a lot, or howsoever we use our brain a lot, does the brain get tired? Is there a limit to learning?
You're asking me?
Yes, sir.
No, there is no limit to learning. There is absolutely no limit to learning. The person who is a doctor can very well become an artist. An artist can become very well a musician. A musician can very well become a sports person. So our brain has no limits in remembrance in terms of learning or acquiring new knowledge and in terms of assimilation of new knowledge. If we look at again in the terms of the analogy to a computer, our brain has about 400 terabytes of storing space, which is equivalent to about 360 channels of OTT running simultaneously for a period of about 5 years. So you can understand the amount of knowledge and the information which our brain can. It is unbelievable and it is very, very high.
Thank you, sir. Thank you. Dr. Navdeep, sir, while Dr. Singh was discussing, he mentioned intelligence. So, would you like to, could you please explain to our viewers what is intelligence and is there some way of changing it, improving it?
As Dr. Sumit said that attention span and the repetition, the number of times we repeat it, then it becomes stored in the permanent memory or the long-term memory. So attention span and repetition actually are very important as far as the intelligence is concerned. Many a times patients they come to us कि kid does not pay attention, बच्चा ध्यान नहीं देता है, he is not good in studies, and when we ask, he is very good in extracurricular activities. Some are good in dancing, some are good in sports, some are good in theater. So it's like one is the interest of the child as far as the kids are concerned. So it is how much attentive we are and how much effort we put in while learning. So everyone is born the same, everyone has got the same kind of brains. It's only how we use them. So that's important.
Thank you. Thank you so much. Dr. Dhamija, sir, I'd like to come over to you. In our past programs, you have mentioned this word cognitive reserve a number of times and the importance of building up cognitive reserve. So I'd request you to elaborate a little bit on this, sir. The role of cognitive reserve, what is it and how to build it?
Let me start with the cognitive fitness. So as we all are passionate about physical fitness, most of the people you will be seeing running and aerobics and brisk walking and that kind of maintaining a physical fitness. That's very important to prevent the lifestyle diseases like diabetes, hypertension, lipids, all these things. So physical fitness is important. But at the same time, equally important is cognitive fitness, your fitness of your brain. And that is maintained by learning new skills, as Dr. Singh said, learning a new, say, becoming a artist or a musician or a sports person. So acquiring a new kind of a hobby or a new language or a new kind of a learning regarding, say, example, if you want to become later on, many of the doctors you must have heard, or many of the other professionals change their profession in the midlife. So a banker becoming something else, in coming into a new profession, or the doctors also leaving the clinical practice, going into research or going into medical teaching. So that way is always something doing new is always making your brain cells or neurons active. So learning a new language is the most important, or learning a procedural skill or a skill is most important, and at the same time remaining socially connected, whether it is through social media or the other avenues. So remaining connected to your friends, making new friends, that is something very, very important for the brain health. And thirdly is a cognitive reserve, which means if you are, for example, if I take liberty of using Dr. Sumit Singh's analogy, uh, if you are riding a bicycle on a climbing or a over hill, so you change your gears, or for example, even in car, you change your gears when you go uphill. And that changing in gears help the car to adjust to that challenge of rising steep height. And that car runs smoothly even on that uphill. Similarly, in the brain also, if there is a sudden insult or there is a trauma or there is some disease occurring in the brain, the rest of the brain has capacity to overcome that insult or a challenge and to maintain the normal functioning. So that is something which we want to achieve, and I think in next 20 years the science will help us to achieve that target. Still, we have a lot of things to improve our brain reserve or cognitive reserve, and in case something happens untoward or there is an insult to the brain, the remaining brain can take it over and maintain the function, at least to survive and to maintain the normal functioning of life. So that is something called cognitive reserve. And there are many ways to improve that cognitive reserve, and that is one of them is cognitive fitness, or to maintain your brain cells active by doing, for example, Sudokus and crosswords. All these things help to make more connections, more synapses, and maintain your neurons in a healthy state, so that the brain can function optimally.
Thank you, sir. Thank you so much. In fact, I was recently reading a book by Edmund T. Rolls, and the number of connections that you've just mentioned is so enormous and humongous that it is very difficult for us even to imagine that if in the brain, on an average brain, there are more than 100 billion neurons, and each neuron is having almost 10,000 connections. So you can just imagine the number of connections that we're having. Sir, Dr. Sumit Singh, sir, does the connections that we build in society between our friends, between our relationships, do they somehow affect the working of our brain, the health of our brain?
Oh, yes, we are all social animals. It is not possible to be healthy mentally if you isolate yourself. You will definitely become depressed, you will become aloof, you will develop cognitively impaired. We gain a lot of knowledge by meeting people, we gain a lot of information by talking to people and meeting them. And of course, there are several aspects to mental health, like being happy, like being engrossed, like being able to perform what you like. So if I want to sing, I will be a hopeless singer if I'm singing alone. But if there are 10 people in front of whom I'm singing, I'll be very happy and I'll get developed what I call as a mental peace. So without being socially active, any form of mental health is impossible.
Thank you, sir. Dr. Nadeeb, please tell us about the effect of, nowadays there are many people, especially I'm sure a lot of people who would be listening to us, they're having shift jobs, they're working in BPOs, working at night. So do these shift jobs somehow affect our brain health?
Definitely, Dr. Rajesh. There are two types of hormones which get secreted from the brain. One is the group of sleep hormones, another is the wake hormones. So secretion of sleep hormones, it begins at around 10 o'clock at night. Between 10 to 11 p.m. is the sleep switch. And around 6 a.m. is the reversal of the switch. So this is the biological time when a person should be sleeping. So many patients who come to us who are working POs, the conditions are uh, most of say नहीं doctor are coming 7 to 8 hours
I think there's some problem in connectivity because we can't hear him properly.
sleep, but number is not with the biology when a person should be sleeping. So once the person is depressed, anxious, so there is lack of exercise, no mental relaxation techniques. So these things
I think Dr. Navdeep has got a connection problem.
Yes, I think he's having some connection problem.
Yeah.
Dr. Nadeep, we can't hear you properly. Your voice is distorted and broken. So I'll come up with next question to Professor Dhameja, sir. So what is, since we are talking today about, I'd like all of us to pay more attention towards health and improvement of functioning. We'll touch on the disease part. I think not in much detail. Obviously, we will have to, and we are going to do on that. But since we are at the health aspect of it, as you have described so beautifully, the importance of brain health and the importance of cognitive fitness. How important is yoga and yogic kriyas and pranayam with respect to the cognitive fitness and with respect to brain health?
Thank you for this question. Actually, it is very important, recently we had a randomized controlled trial of effect of, it's now in PubMed, published already last year. The effect of pranayam on mental health of the persons who were exposed to COVID-19. All these healthcare professionals, doctors, nurses, who were exposed to COVID-19 but did not have the COVID-19 disease. They didn't develop it, but they were exposed there. And during the time of their isolation and the quarantine, when they were afraid of probably they will develop the disease, during that time of 28 days, we subjected half of them to pranayam, a 30 minutes protocol, which is available on YouTube now, morning and evening. So right from the prayers to the deep breathing and all kriyas. So 30 minutes, very simple pranayam program, and that improved the mental health of people who were exposed to COVID-19. So the anxiety, the insecurity, the fear of catching a disease, living in a stressful environment, working with life and death every day, that was a condition in which the pranayam really helped to come out of that situation. And that half of that group which was subjected to pranayam had a very good outcome, much better outcome than normal control arm. So obviously, pranayam has a very important effect on calming down your nerves and improving your brain health. So in addition to your diet, exercise, sleep, the yoga, and now it is time tested practice that helps in your mental health, not only alleviating the depression and anxiety, but also improving overall mental health of these people who are exposed to extreme stress in life.
So I think it is very important that your study, which you mentioned, shows the direct relationship between brain health and mental health, and the importance of doing these yogic kriyas, which actually is our heritage, but somehow we are still not able to focus on them bring back that to life into our daily lives, and which we should be doing. And I'm sure, sir, that you and your institution is doing a lot in promoting this aspect of our life. Thank you so much. Dr. Sumit Singh, sir, how about sleep? Does the amount of sleep, the quality of sleep also affect the brain health?
Oh, yes, it does. We all experience it. We very well know that the day we are not able to sleep well, the next day is a disaster. We are not able to focus. We are not able to understand several things. We are becoming irritable. We become anxious. We become angry on small things. So, sleep is a very, very important part, and our 6 to 7 hours of sleep is an absolute essential. And also, not only the timing of sleep, but the quality of sleep and the time which we spend in several segments of sleep is also equally important. It has also been observed that it is also very, very necessary that the sleeping time is adequate, the onset of sleep and the getting up time, because sleeping at 4 in the morning and getting up at 10 in the morning is also a 6 hour sleep, but this will not be as fruitful and as refreshing sleep as a regular 11 to 5 or 11 to 6 sleep. So this is also important. Sleep is a process by which the brain heals itself, and there are a lot of chemical and electrical activities which are going on in our brain all 24 hours every single day from the time of our birth till the time of our death. So the brain does need some rest, and this rest is definitely more important for rejuvenating the brain again on the next day. So resting will be very, very important to keep a patient cognitively healthy and active.
Thank you, sir. Thank you. I think that is very important for all of us to understand that sleep and sleeping during the right hours is also just as important as physical activity. Now, coming to the physical activity and the related aspects, how about the lifestyle? Can lifestyle in general affect the working of our brain? Dr. Navdeep, sir, are you there?
Yeah, sorry, there was some connectivity issue.
Yes, yes, yes. Please.
So there are a few pillars of brain health. So first is the physical activity. Most of us, we are so much engrossed in our daily routine that we hardly prioritize our health. You ask anyone, I'm busy there, I'm busy there. Everyone has different priorities, but people, they don't tend to spare 30 or 20 minutes in a day for their own health. So this is a very important thing. Other is social well-being. Interacting with friends is very important. It gives us happiness, rejuvenation. Then healthy diet is equally important. What we are feeding to our body will get the same results. Mental health is very important. Some kind of relaxation techniques, as Dr. Dhamija mentioned about meditation and yoga, it also affects a lot. So ample time of sleep, as told by Dr. Sumit, all these are important pillars for the mental health. So physical activity does play a very important role. Once you are physically active, you are involved in any kind of exercise, playing any game, gym, dance, yoga, Zumba, any kind, whatever you like. And if you're doing it regularly, it gives you a different happiness and different kind of energy levels throughout the day. Your output is better. So it definitely is important for your brain and yourself.
Thank you. Thank you, sir. Professor Vija, sir, I remember when I was small, and I remember especially when we used to have exams and like the board exams, my mother would prepare what we call in Uttar Pradesh Kamal Gatta. I think these are lotus seeds or lotus roots, a halwa made of that. So, and it is considered in our family that it increases the power of your brain and memory. So, well, I want to come to the nutritive aspect of brain health. So, are there some special foods? And I would request later on all of you to contribute on this. Professor Dhamija, sir, I would request you to start. Sir, please unmute yourself.
So role of diet is very, very important in not only in physical health, but also in brain health. So having a nutritious diet, green leafy vegetables, and all these things are important. If you are talking about increasing your memory and increasing your attention and increasing your intelligence, I'm not aware of any particular food. Maybe some of the label Korean and ginsengs, all these are promoted, but there is no scientific evidence for that. Whether you eat badams or you eat anything, they are not specifically for brain. They are otherwise the polyunsaturated fatty fats are good for overall health. But my own consumption is that for the time immemorial, Brahmi booty, which is normally available everywhere, is supposed to be good for as a tonic for your brain. Whether it works as a placebo or it actually works, nobody knows. But certainly, people have been using it, and many of my friends and patients do come and ask about the Brahmi booty in children, growing children, and that's something which is very popular amongst the parents. So that is something important. So, but coming to brain health and brain disorders, so I will just give a very simple message to your audience. Cut down your sugar and cut down your salt. So these two things, if you cut down your salt and cut down your sugar, if you are at risk of developing brain diseases like strokes and neurodegenerative disorders, so these two things are important. So management of even if you have a diabetes is as good if you prevent diabetes, if you don't take too much of sugary foods or high glycemic index foods. So cut down your sugar and salt. That's very important. The other thing is having a balanced diet. So having 5 to 6 servings of fruits, colored fruits, as we say, the various colors, they are very important. Whether it is a watermelon or it is a mango or it is a green apple or it is uh, yellow colored fruits or it is chikus, all these things, if they are not having a very high sugar content, should be taken in abundance in addition to your green leafy vegetables and salads. So I recommend 5 to 6 servings of fruits and salads every day. Take plenty of water and have a balanced food in terms of low carb and high protein and medium fat, which is recommended at 30, 40, 30. So obviously the balance has to be there in addition to your normal micronutrients and the other component which are essential for your diet. In addition to diet, of course, the physical exercise, as Dr. Navdeep was saying, is very, very important. The physical exercise and the walking, particularly brisk walking, releases endorphins in our brain, which is the happy hormones, what we call them. So this also acts as a very good and a very potent antidepressant, walking particularly, and walking is a new medicine of this age. So that is something which is very, very important. And the other pillars, as Dr. Nazif said, we will discuss it, whether it is sleep or it is the mental health or it is the pranayam and all these things. They are all component of improving a very good brain health, and that is something message we need to give through this webinar.
Yes, definitely exercise and diet are very important, and we're going to discuss more in detail. Dr. Sumit Singh, sir, would you like to add on something or elaborate on the nutrition and brain health aspect?
Yeah, people usually feel that all costly stuff, if it is consumed, will increase your memory. So badam, pista, kaju, they all enter into that domain. And also this badam ka halwa and excess of ghee. This was practiced even in my times with my mother, was giving me these things to eat during my exams. So apart from the nutritional part, which sir already had said, I think maintenance of adequate amounts of vitamins in the body is also important. So there are few vitamins which are definitely associated with the decreased memory. So maintenance of these vitamins, like vitamin B12, is very important. So vitamin B12 is rich in non-vegetarian food, but amongst the vegetarian food, it is very rich in the fermented foods like homemade dosas, homemade uttapams, homemade idlis. It is very rich in uh, sprouts. So these are the things which need to be maintained. A normal thyroid is essential for a good memory. If you have thyroid problems, your memory will go for a toss. So if a person does feel that he wants to feel a better memory, then he should get these things checked and try to replenish them with the adequate foodstuffs if required.
Thank you, sir. Dr. Navdeep, would you also like to add something to whatever has been said?
Most of the things have already been covered by Dr. Dhamija and Dr. Sumit. I would just like to add that as far as the brain health is concerned, we should maintain the normal, we should maintain all the risk factors, the vascular risk factors. We should have a normal blood pressure, normal cholesterol levels, normal blood sugar levels, whether on medications, off medications. These things are all equally important and they help in preventing a lot of diseases which can happen in the later stages, like very important preventing stroke, dementia. So in addition to diet, the control of these risk factors also plays a equally important role.
That is absolutely correct. I'm sure. Till yet, we've been discussing about the brain health, and I think, and that was for all the normal adults. But as we see that almost in the metros, more than 10% of adults are having diabetes. Similarly, for hypertension, for all other metabolic disorders. So I think if we don't touch upon these diseases and how people living with these diseases, how the brain health of these people is affected, and what they should be doing to prevent that, we would be doing injustice to our audience. So, as I understand that the atherosclerotic disease is probably one of the very important diseases in which causes the maximum harm which can cause to patients who are having these conditions. So, Dr. Sumit Singh, sir, I would request you to elaborate on this. What happens during such diseases? How common is it in the brain? Because you are heading this department.
See, the concept is that these things, if maintained in their normalcy, are okay for brain health, more so for memory. But if you have a disease which has already evolved, like if a person already has developed dementia, then management of these risk factors become all the more important. So if memory problems have actually gone to a level of a disease, then in those cases maintenance of these parameters become very, very important. So maintenance of good cholesterol to a lower level, sorry, a good cholesterol to a higher level and a bad cholesterol to a lower level is very, very important for advancing or prevention of advancement of atherosclerosis. So these things are important. Blood pressure, if it is not controlled, will also increase and enhance atherosclerosis. Diabetes will also enhance atherosclerosis. Then I think it is also worthwhile touching the social evils like smoking, alcohol, drugs, and social media, which is also probably as important as these things, because there are several studies which indicate that increased screen time is associated with increased risk of neurological disorders.
Thank you, sir. Thank you. And Professor Dhamija, sir, as Dr. Sumit Singh has just started talking about this, so would you also please like to elaborate what happens to people who have hypertension and who have diabetes, why they should be more worried about their brain health than other people?
So these, whether it is diabetes or hypertension or increase in cholesterol, they're all vascular risk factors. And once you have this long-standing lifestyle diseases, including diabetes, hypertension, hyperlipidemia, you are at a higher risk of developing strokes and the dementia and other neurodegenerative disorders. So let us talk about stroke, spend a minute on stroke. So we need to know the warning signs of stroke. What are the, how do we should identify the strokes by the acronym BFAST, whether the sudden onset, this is word is sudden onset of losing balance, either by vertigo or giddiness, or losing sight in one eye, or losing having weakness in the arm or leg, or facial droop, or difficulty in speaking. So this is something which we should all, propagate and advertise to the general masses, that they should be able to identify. And once the any one of them, or the family or the friends or the in their social circle had sudden onset of these 5 symptoms, loss of balance, loss of vision, loss of power in the or the weakness in the arm or leg, and loss of speech or facial droop, then the time is the essence. So immediately they should rush to the larger neurological hospitals like Dr. Sumit Singh works or I work or Dr. Navdeep work, where we can immediately treat the clots or the clots, what we call atherosclerotic stroke. So there is a time window of 4.5 hours. So immediately we should not be wasting time by going to this place or that place. So immediately rush to call the ambulance and rush to the big hospital where clot busting drugs are available. And that has happened in last 30 years. And we are seeing a revolution in the treatment of strokes, whether it is the clot busting drugs or the mechanical thrombectomies or clot removals. So these are very important because time is crucial and the time window is important. So rather than wasting time, let us sensitize the people to rush to the hospital so that the strokes could be treated. So these are all risk factors. The hypertension again leads to the defect in the arteries, and arteries can burst and there can be brain hemorrhage. So sudden hemorrhage or sudden shooting of a blood pressure or long-standing blood pressure will weaken the arteries which carries blood to the brain. So obviously in the brain, intracranial, so obviously if there is a bleeding or the rupture of the arteries, it can be catastrophic and immediately one should go to the rush to the hospital. So these are important to know what are the risk factors and how to identify or the warning signs or red flags in the symptoms if they are sudden onset, and what to do in that case rather than wasting time. They rush the patient to the facility where the treatment is available.
Thank you, sir. Thank you so much. I think I'm very thankful to you for bringing up this topic and to sensitize our viewers on the importance of stroke, because it really happens a number of times. I have seen in my practice as well that people will call up their family physicians. Like, I'm a family physician, people will call me up and ask कि अरे ये हो रहा है, एक आंख से दिख नहीं रहा है या हाथ हिल नहीं रहा है, आप एक बार आके देख लीजिए. So rather than wasting time for visiting a doctor or waiting for a doctor's OPD time, the patient with such signs as you've mentioned about FAST should be immediately rushed to hospital where he can be given medical assistance in this golden hour, as you've said, in the time when still the changes can be reversed and a lot can be done for such patient. Otherwise, they might lose some very important functions throughout their life. So thank you so much for bringing up this topic, sir. Dr. Navdeep Kumar, I would like to ask you, as you have, as Professor Dhamija had in his initial introductory talk mentioned about epilepsy, that initially when WHO thought of of declaring the World Health Day, they thought of epilepsy. So would you like to elaborate the common causes of epilepsy in our country? And I would request later Professor Dhamija sir also to sensitize our audience and population about epilepsy, because people frequently get carried away because we have so many tantrics and all different streams of medicine and treatment, which people get carried away. How to prevent that and sensitize people? So I'll start with you, Dr. Navdeep. A little introduction and then we'll move on.
So epilepsy is one of the most common neurological disorders, which carries a lot of morbidity and is responsible for mortality also. Epilepsy, for the audience, it's basically an abnormal electrical activity in the brain, which leads to abnormal tonic-clonic posturing of the body, loss of consciousness, and the episode usually lasts for 2 to 3 minutes, and it stops on its own in most of the cases. It can be recurrent also. There are different types of epilepsies. The one which is most common and people mostly are aware is, we call it generalized tonic-clonic seizure, and there are around 13-14 types of epilepsies: myoclonic jerks, absence seizures, tonic, atonic seizures. So coming to the etiology or the causes of epilepsy, India being a tropical country, infections play a very important role, especially neurocystic psychosis and tuberculosis. Then there are a lot of hereditary factors. Then there are epileptic syndromes, then trauma, brain tumors, stroke. All these are important causes which lead to epilepsy. So it is very important to diagnose which type of epilepsy a child is suffering from or a person is suffering from, because if we are able to diagnose properly that which epileptic syndrome it is affected from, yeah, which type of epilepsy, it's focal onset or it's generalized onset, then the proper diagnosis helps us in choosing the appropriate medication and providing a better control to the patients.
Thank you. Thank you, sir. Professor Dhamija, sir, I would request you to sensitize our audience about the importance of treatment of epilepsy, that it is treatable with modern medicines.
Thank you. So again, as Dr. Navdeep Kumar said, this is something like a spark in the plug, or if you simplify this as electrical activity, which is a sudden onset and excessive firing of the neurons. Obviously, when the short circuiting happens in our homes, so there is a sudden sparking. So that is something exactly happens in the brain, and that leads to a seizure or a fit. And once it is a recurrent seizure, we call it epilepsy. So that is a common thing. But having said that, there are 1 crore people in India living with epilepsy, which is again underestimate of our understanding of disease. So epilepsy is like any other disease. People have diabetes, people have hypertension, people can have epilepsy also. It is purely treatable in most of the cases, except few GMEs and other things where we need lifelong treatment. But it is treatable majority of the patients with epilepsy. That's number one. Number two, the stigma around epilepsy, whether it is driving or marriage or childbirth or pregnancy, this has to be removed from the society, as it is a disease like any other disease. So we must educate our people. Do not hide this. Do not take this as some curse from the tantric or some bad okay, पिछले जन्म की कुछ ऐसा किया हुआ. So obviously this is a disease of the brain, and this has a symptoms, and this is a treatable, and this is a causes also. When many of the epilepsies have a underlying cause like head injuries or infections or stroke, all these things can be leading on to symptomatic seizures. Even the low sodium or a low calcium or a low glucose can also present like in a seizure. So it is not something again a tantric. So do not do a juta sunghaing or putting a chammach forcefully or something like this. Just try to have a first aid training to the people. Just keep the patient on one side. Most of the 99% of the seizures would terminate in 1 minute time. So maximum 1 to 2 minutes. So it's just that 2 minutes you have to tide over. Put it on the side. Don't put forcefully anything. There could be an injury to the tongue because of the clenching of the teeth. So there could be an injury because of a sudden fall on the ground. So prevent that fall. Remove all the sharp things around, and within 2 minutes the patient will stop seizing, and then after sometimes patient can come back to the normal. So obviously the people should take it as a disease and take it to the neurologist for the optimum treatment of epilepsy. There are very good centers like Dr. Sumit Center, Dr. Navdeep centers in private sector and in arts and government sector. So rather than going to Rishikesh or going to other places, go to a neurologist so that he can identify the type of epilepsy, he can give you right investigations and then treat according to the disease itself and control it. And remember, not taking medicine or missing a medicine can lead to a breakthrough seizure. So it is as important to take medicine as important to take food. So once you are on anti-epileptic medications, you do not stop unless the advised by your neurologist after thorough assessment whether this patient can withdraw anti-epileptic or anti-seizure medications or not. And there are various indicators where parameters, normal EEG, no fit for last 2 to 3 years, all these things neurologists will see and then decide. And during the tapering of time, there are certain precautions that you don't drive during the tapering of time, and you be careful about your sleeping time and your eating time, no fasting, no delayed or late nights. All these things a neurologist will look after that. So my request through you and through your webinar to the listeners, to the viewers, is that if you or your family member or your friends or your neighbor has an epilepsy, give it to the proper investigation, proper treatment, and take it to the neurologist.
Thank you, sir. I think that was very important message that you have given out through this platform, and I'm very thankful to you for bringing this up. Thank you so much, sir. Dr. Sumit Singh, sir, I would like to ask you a personal question. Is limited amount of alcohol also deleterious for brain health?
Why did you ask me this specific question? That is an important thing. And why was this personal for me?
No, it was
So
not
no
personal
alcohol.
for you. You were just next.
So alcohol in moderation has no problem, but the point is to keep the alcohol in moderation is a problem.
That is very
So,
true.
So 2 drinks of any type of alcohol twice a week is what is permitted, is okay. But the point is to restrict somebody to a 2 times a week schedule is difficult. And there are no basically restrictions to alcohol, but yes, these things should be taken into consideration.
Thank you. I think this is something which many of our participants, I'm quite sure, were looking forward to. Professor Dhamija, sir, I'd like to come back to you, and I would like to ask you about the brain health of the elderly. Are there any special precautions, or is there something you would like to say about this? Because this is a special group of population. Sir.
Absolutely right. And it's not only special, but it's an increasing number of elderly in our country. With the aging population and longevity increasing and the increase in life expectancy, we are likely to see much more proportion of elderly individual in next 20 years. So we need to be ready for that, and we need to sensitize the population how to be graceful aging or a healthy aging. That's very important. And growing up or elderly more than 60 years, of course, all these risk factors have to be managed. The elderly population does not mean that they will be having just the numbers. They will also be living with diseases of the aging. So whether it is heart attacks or it is neurodegenerative, Parkinson's or dementia or epilepsy, all these things will happen with this increasing number of elderly individuals. So what I suggest is that I will just try to wind up by giving 10 messages to your audience. So we'll start from the exercise. 20 minutes of brisk walking or 1,000 or 10,000 steps a day, at least 4 to 5 times a week, is something which we should achieve by doing regularly. So that is something for physical and cognitive fitness. Then the hydration. It is important to have a lot of fluids, whether pure water, that is something which is important to prevent, particularly in tropical country like India. The third is sleep. So not only having a 7-8 hour sleep, it is also important to improve the quality of sleep in terms of sleep hygiene. So in your bedroom, there should be only sleeping, nothing else, no TV, no entertainment, and no laptop, no phones, no computers, no TV. Decrease in screen time and a good quality sleep, a refreshing sleep, so that the brain can recharge our batteries. So that is number 3. Fourth is learning. Whole life we should strive to learn new things. Learning is a lifelong process. So whatever we have the opportunity to learn, we should grab that opportunity and learn this, whether it is language or hobby or book or anything like that. So learning should be ongoing, lifelong. Fourth is connections. So socially, we should be able to connect to the society rather than loneliness. Loneliness is a risk factor for dementia, not only for dementia, but many other diseases also. Social isolation is very, very harmful, particularly in isolated communities or in elderly. The fifth is diet, or rather sixth. Diet, as we have already mentioned, for 5 to 6 servings of fruits and vegetables, cut down salt and sugar, and look for your sugars in blood and the blood pressure. Seventh is challenge yourself. Challenge yourself for your own targets, your own barriers, your own benchmark. So try to strive to improve your, whether it is exercise or it is diet or it is other things. So try to set goals and achieve those goals, realistic goals. Fourth is lifestyle habits. So lifestyle habits like poor sleep, or alcohol, or smoking, or all these things, you need to either stop it or cut down, as the alcohol Dr. Smith saying, in moderation. So that is something very important. Fourth is breathing or the pranayam or mental peace or man ki shanti. That is important. Not to try to be least expectation is least disappointment. Don't be having too much of expectations and to prevent the disappointment. And the last one is 10th is the mental health. So if you have no health is complete without the mental health. So if you are having stress, whether it is related to work or domestic or social circle, whatever stress, financial, whatever it is, you need to cut down and come out of that stress, and you need to know how to deal with this stress in everyday life. Although stress we say is inevitable, but how we handle it, that we should learn to do it. And these 10 pillars or 10 markers is very important for brain health. And I always say, if we have these 10 points written on our table, we will do it, at least half of them, and we will achieve optimum brain health.
Wonderful, sir. Wonderful. Thank you so much for this. Dr. Navdeep Kumar, sir, what is going to be your message to our audience?
Sir has already concluded.
Okay, so you agree with him in all his.
Conclusion from my side, not the webinar conclusion.
It was the conclusion of his answer. It is usually customary that all our panelists give a parting message to our audience. So that may be your summation or whatever you feel is important.
See, one should learn to live life. One should learn to live in the present. This is what COVID has reinforced.
This is a very, very important thing, the power of now.
Yes. So live in the present, take good care of yourself, and needs to plan for future. But
Yes.
learn to live the life.
Great.
That's important.
Great. I think this is also wonderful. Dr. Sumit Singh, sir, what would be your message to our audience today?
I would request Dr. Sumit to give us a shero shari little bit to create and give a message. He's very good in his shero shari.
Okay, so I'll
It conveys the message very effectively.
So
Yes.
Tomorrow is a mystery. Yesterday is a history. And today is the reality. That is why you call it as a present. So enjoy this present while you can. Live your life to the fullest. Enjoy what you want to do. Because what you want to do will eventually take you forward to whatever you will be in your life in future.
Absolutely.
Wonderful. Absolutely. Perfectly said. And sir, Professor Dhamija, this would be your concluding message.
I think the message should be that you look after your brain. Brain is eventually the powerhouse, and that takes the life forward and a command center. So as you look for your physical health, please look for your cognitive health also, cognitive fitness also.
Thank you so much. Thank you so much. Thank you so much. I'm so thankful to all of you, Professor Dhamija, Dr. Sumit Singh sir, and Dr. Navdeep Kumar. You've added so much knowledge and with all your wonderful guidance and experiences that you've just related. I'm sure that our audience has learned a lot, and they would be emulating whatever has been said in their daily lives, and they would have definitely a better life and healthier and smarter brains, I'm sure. So thank you so much for being with us today. And I wish to thank you, all of you, from all of my heart, and on behalf of Shri Anil Rajputji. Unfortunately, he is not here with us today, but he's specially asked me to express his gratitude to all of you, and especially to you, Dr. Dhamija, for taking up this honorable cause and starting a year with this wonderful topic of brain health. And it has been a learning experience even for me, and I'm sure, as I've said, for all the members of audience. So thank you so much, and I'm very thankful to SOCHM and Team SOCHM, to Mr. Sandeep Jain ji, to Richa, to Aditya, and all the colleagues who've put up so much efforts in organizing this webinar, even just after the holidays, and bringing us all together. So thank you so much. Thank you.
Thank you, everybody. Thanks.
Thank you.
Have a good evening. Bye.
Thank you so much. Good evening. Thank you. Bye.
Thank you, sir. Thank you.